In this module, we'll be discussing basal cell carcinoma, which is the most common type of skin cancer. So let's get into it. There are several types of skin cancer. Basal cell carcinoma, as stated, is the most common one. Most of these present as a sore that won't heal, and patients often mistake them for sometimes a pimple or an infected hair or something like that, but it simply never goes away. Basal cell carcinoma in most cases is due to long-standing sun damage or UV radiation damage, which you could also get from a tanning bed as well, although most of the time it seems to arise from just people being in the sun for years and years, causing cumulative skin damage. These usually occur, stated, in sun-exposed skin. In men, 90% or so are on the head and neck area. In women, sometimes they're in a little bit more diverse areas. Sometimes we see them on the torso and the upper back and even on the legs sometimes. I think about 25% or so are usually on the torso. And occasionally we'll also see them in the groin area. And sometimes if patients have had radiation treatments in the groin area, say for prostate cancer as an example, basal cell might arise in that setting. One of the interesting things about basal cell carcinoma is it rarely spreads through the body or metastasizes, unlike many other cancers. Less than 1% or so of the time will it spread, which is good, certainly. Local destruction, however, is one of the biggest issues. So while the tumor doesn't spread very often into lymph nodes or distant organs, the local tissue destruction is a big problem with these, particularly if they're not addressed efficiently. Since they're often on the face as well, that kind of destruction can really lead to problems. So how do we diagnose basal cell carcinoma? It's oftentimes suspected clinically, but it's diagnosed with a biopsy of the skin, which is a very easy procedure done by the dermatologist in clinic. After a biopsy is done, there are several types of basal cell that can be found on biopsy, and sometimes the type matters when it comes to treatment. There are some lower risk types that don't tend to get very deep in their growth pattern. These are called nodular and superficial types, and these tend to be, as stated, a little bit lower risk for deeper invasion and major problems. There are a few higher risk forms which I have highlighted here, and we call those infiltrative, morphiiform, and micronodular types. Again, these are types of basal cell found by the pathologist on biopsy, and sometimes if you have this type, the tumor can invade a little more deeply and sometimes be a little bit more difficult to clear. So here you see an example of a typical ball-like or nodular basal cell carcinoma. You can see that it's ulcerated on the top, which is a common feature of it. And you can also see on the side little blood vessels, which are sometimes a tip-off for the doctor that that's what's going on. Here in this slide you see an example of a superficial basal cell carcinoma, and as you look at this you might even think it's a rash, as many patients will come in feeling like they may have a ringworm on their body, but instead it is a superficial type of basal cell carcinoma which grows sort of like a plate. It spreads across the skin surface. This doesn't look like a whole lot, but this is in fact an infiltrative basal cell carcinoma, which tends to sometimes not have the classic features that the other ones will. It almost looks like a scar here, and sometimes these get fairly large before they're diagnosed, unfortunately. So how do you treat basal cell carcinoma? Well, there are a lot of different ways. The standard way is called surgical excision, where the doctor cuts the cancer out and puts some stitches in to close a wound. It's done very commonly. There's also a variant of that called Mohs surgery, which is very useful for some types of basal cell carcinoma. Mohs surgery, the tumor is removed and the edges are processed right there, and once the doctor has all the cancer out, then the wound is closed on the spot. Has a very high cure rate, but does take quite a few hours usually to perform. Another way is called electrodesiccation and curettage. In this method, the cancer is, after it's numbed, it's scraped away and the base is cauterized, and several cycles of that's performed. And in experienced hands, it has a pretty good cure rate, particularly for low-risk subtypes that we mentioned earlier. There are some medicines that you can get with a prescription that work on this as well, and they're useful also for some of the low-risk types, particularly superficial basal cell carcinoma can be eliminated with these medications. Radiation therapy can also be used. That has radiation we don't use real commonly. Oftentimes for people who don't want or can't have surgery, sometimes we'll opt for radiation. And there is a new medication which is called vismodegib, and this drug is approved for those people who have very large, advanced, unresectable tumors, or the rare instances where they do spread or metastasize. This drug can be used, although it's very new, hasn't been out very long, so it's certainly a novel therapy. Overall, early detection and treatment are critical for the best possible outcome. Always you want to get a sore that won't heal, that bleeds easily, particularly in sun-damaged area. Get those things checked so that it can be diagnosed and treated as efficiently as possible, and that will give you the best outcome if you have basal cell carcinoma. Thank you for your attention. We hope you found this module helpful. As always, check out our other modules. Thank you.